Favorite thing about working in infectious diseases is interacting with patients and their families and just watching kids get better. I think that's the most special part of dealing with kids who have these infections.
I love taking care of children, and the relationship with patients and parents is so wonderful to get to know these kids and help them feel better. We're really looking for fellows that have thirst for knowledge. I just really like that you can do so many different things with our fellowship, and with your infectious disease training, we're looking for people that are interested in learning and trying to find the answer for our patients.
We have a strong outpatient clinic that sees dozens of kids every week, and our fellows have at least a half day of clinic every month to be able to experience what it means to take care of kids.
So the first year is heavily weighted in clinical practice, where they spend over half the year on either the general service, which is a primary team where we have our own patients, but also consult patients. And then their second and third years or fourth years is really the time to focus on their research. So we're really lucky we have lots of opportunities to take care of immunocompromised patients. We see many patients with transplants, solid organ and bone marrow transplants, and unfortunately those patients sometimes develop severe, significant infections that our team can help with.
We have a really strong immunocompromised infectious diseases team. It's a consult team that interacts very closely with our colleagues in oncology and our different transplant teams. With building our call schedule for our fellows, we offer a lot of flexibility that takes into account different situations. Our fellows take call over the weekends, but are very supported by and attending all the time. Our goal as a fellowship program is to help our fellows become leaders in academic medicine.
With our Indiana Center for Global Health, we have opportunities for research in diverse fields of study, from aging and in care or child development to immunology and gut microbiome and HIV, malaria, and TB. Our field sites for infectious disease research are primarily within Kenya and Uganda, where we have research teams working on the ground and the infrastructure to help support fellow and trainee research. Because of the clinical flexibility we have within our Pediatric Infectious Disease Fellowship, it allows for opportunities to do longer-term projects, even up to 6 months in international settings. If fellows are interested in even longer-term projects, perhaps for a year or more, we also have options for a Fogarty Fellowship that they could apply to.
Our fellows certainly don't need to apply for grants as part of their fellowship, but we do encourage them to do that just to get the opportunity to learn what that process looks like. And there's lots of different opportunities that we could steer our fellows toward. We have some internal grant opportunities like the Morris Green Scholars Program, and there's lots of different foundational grant opportunities as well. Our fellows have access to all of the GME wellness opportunities that IU and Riley offer. We also come together multiple times during the year for wellness retreats. India is a really cool place to live. I've really enjoyed exploring all of the outdoor opportunities in the area. There's lots of great bike paths and great parks.
It's very affordable, but there's also lots to do, lots of concerts and restaurants. It's easy to get to the airport. It's a close trip to Chicago or other major cities.
There's so many different angles that pediatric infectious diseases doctors can take their careers, whether it's in infection prevention and control, antimicrobial stewardship, rounding in the hospital. There's so many different angles to that, and our goal is to create well-rounded fellows who can take any one of those aspects forward.